Hello, I am Adiha from Top Tips in Dentistry, and today I want to show you how to use this blood glucose monitoring kit. In a dental practice, we sometimes have to use it, so I hope you find this video useful.
Hello everyone, Madia has asked me to do a little video for Top Tips for Dentistry. I have been asked to show how to use a glucose monitoring kit. A lot of dental practices have the glucose RX Lancet kit, which looks like this. It's a Nexus brand, and what you have to remember is that these kits are best if you're storing them for medical emergency use without the batteries in them, but keep the batteries right next door. You do have a little packet that comes in, so you can store the batteries in there. So that's the kit. You've got to notice that it will never be switched on unless you actually put a test strip in there. So as soon as you put the test strip in there, just give you a little idea of how this goes in. Here we go. It will switch itself on. So you'll just start to see some monitoring, and it's sort of flashing to say it needs a blood sample on the end. Okay, so as soon as you take it off or out, it will switch itself off, so it's automatic. Okay, now the other thing that comes in your kit is the actual Lancet. These come in a box like this. There's about 200 in here, and these are usually about £6 a box. And the other thing that comes, of course, with the kit is the actual test strip, and these come in a little box like this or a little box like this, and these are the most expensive bit, which is like £18 for about 50 pieces. Okay, now what you want to do is get your Lancet pen and have it ready. So in the clinic, the way to have it ready is there's a little arrow here, just about there, and you just twist it. And then it will open up. Once it's open, you've got your little Lancet there. Underneath this little round thing is the needle. So that part slots in there. So you just squeeze it there. And then you just twist the top bit off, and there's a tiny little needle there. As you can see that. Okay, so you have to be careful. Then the lid will just slide over the top and click in, and where the arrows are, you just line it back up. That's ready. The other thing that you'll notice is some markings just on the top there, and that just shows you, say if somebody has got very thick skin, you want to have it on a longer notch, and somebody that's very frail, thin skin, you want to have it on a lighter notch. So again, you might just get to see that. Here we go in focus. Okay. Now I tend to have it somewhere in the middle. And then what you need to do is just pull the end, and you'll get an orange mark coming there. That shows that the whole gadget is now ready to use. Okay. So you can pop this away, and when there's an emergency, you can take or when you need to use it, you can take the Lancet pen out and have one of these strips ready. You always hold it away from where the blood sample is going to be. There's some arrows there to show you that you hold it on that end, and a drop to avoid holding it on the other end. So I'm just going to, and the way to actually take the sample is actually to press on the button where you see the orange mark. So I'm just going to use my thumb here, just like a little pinch really. I'm not very good at bleeding, so I'm just going to see if I can get, there we go, got a little bit of blood out there, and we're just going to touch the end of that. So we're just going to touch, and immediately it says 5, 7.8. So always have the test strip in there and then just dab the patient's thumb onto that. So I'm 7.8 millimoles. Normal is between 3 and 11, so that's perfect. Okay,